the motion be agreed to, and call the member for Bendigo.
Thank you, Deputy Speaker. Well, I have to confess, when I saw it on the front page of the paper today, I thought for a moment it was April Fool's Day. I thought this had to be a joke, because surely how could this government go after Medicare? And how could this government trust it and involve the disgraced minister, the Minister for Human Services, and involve him in this process? I mean, this government is so classically Liberal, it's hard to determine how on earth the Australian people could get behind them at the last election. But they did, and we are now here today learning exactly how much this government cares about Medicare. They've tried over and over again in this term of parliament to kill off Medicare. They've tried to bring in a GP co-payment and force our doctors to be tax collectors, force them to collect $7 per GP visit, $2 for their own administration, and then pass $5 on to the government. Well, that failed. And that failed because doctors and patients and the Australian community said no. And for the first time in many years, we saw the AMA fire up, become one of the most militant and strongest unions that we have in this country, stare down their mates in the Liberal Party and say, we reject your GP co-payment and what you're trying to do to Medicare. Then we've seen the cuts to hospitals. There's a reason why our hospitals are now crying out against this government. In my own electorate of Bendigo, they cut $34 million from Bendigo Health, $40 million from hospitals in total. And that's some of our smallest hospitals, the Kyneton Hospital, the Heathcote Hospital, the Castlemaine Hospital, who are saying to me, we're actually better off not seeing patients, then we'll break even. But the moment we start seeing patients, we start going broke, because this government cut the operating budget and they're not paying their fair share to our hospitals. But it hasn't stopped with the previous Prime Minister. It's continued under this Prime Minister. And Malcolm Turnbull has brought back and backed the exact same cuts of the previous Prime Minister. And that only confirms one thing. This is a Liberal agenda. This is a Prime Minister that is purely and simply pursuing the Liberal agenda. And we've known that since the creation of Medicare. They will do anything to outsource, cut, to sell off this public institution that ensures that Australians have universal access to health care. Why are they so opposed to ordinary Australians having decent access to Medicare? Why do they want to deny people in our community access to good quality health care through our Medicare system? It's a question that Australians have asked themselves for generations. Why do Liberals not understand it's something that Australians want? But we're very happy to fight an election on this issue, because when health is at the top of the priority list, these people do not look to the Liberals for answers, they look to Labor for the answers. And then today's great announcement that they're going to fatten up basically parts of Medicare and sell it off to the market. You can forgive for a moment the shock of the CEO of Australia Post, who has been angling and saying Australia Post could help the government deliver some of these services. Australia Post, as we know, is a government entity, and the CEO was keen to talk to the government about how a government entity could support other parts of government in delivering services. But this government has completely bypassed Australia Post, completely bypassed an Australian government entity, and are talking about going straight to the market. They are so obsessed with selling off public assets and public services, they've gone straight to the market. And today, in question time, could not even rule out whether overseas companies could bid for that contract. That is the last thing Australians want, is when they're looking for support with Medicare, is that their public health care records are going overseas. Australians hate the outsourcing. They hate Australian jobs going overseas, particularly when it comes to their public service. And the government needs to rule that out. The government needs to be honest with the Australian people. It needs to stop going after Medicare. It needs to reinvest in Medicare. It needs to put the funding back into healthcare and actually stand up for the institution. You know, for 20 years I've been asking people to sign a Medicare petition, Save Medicare, and that trend's going to continue because this government don't seem to understand.